So our last breastfeeding video looked at the keys to success. This time we're going to think about the practicalities of feeding. So how do you know when your baby is hungry? We can all recognise a crying baby who's hungry, but actually that is the last signal they'll give you. Before that they will have tried several other methods of small signals, body language, expecting you to pick up on them. If you're very observant, you may notice your baby firstly sniffing the air to try and find the source of the milk, and with that comes a turning of the head as they are trying to locate the milk, possibly with their mouth opening, sticking out their tongue, or licking their lips, or making sort of a smacking noise with their mouth. They may also bring their fist up to their mouth to suggest that they want to suck on something, or try and latch onto anything that's nearby. It might be your upper arm, it might be your upper chest, it might be your chin, it might be your nose, but they're trying to find something that might have milk in it. So if you can realize these cues and get your baby onto the breast whilst they're showing you before they cry, you'll probably find it's much easier to feed them because they're not yet starving and very distressed. What would you do if your baby was fussing at the breast and didn't appear to be comfortable there? Firstly, check their positioning and make sure that they're comfortable at the breast and that they are able to take a good mouthful of breast. It may be that they are partway through a feed and uncomfortable because of wind, so you may need to take them off and burp them. This can be done either up on your shoulder, patting their back, rubbing their back in an upwards movement, circling on their back, rocking backwards and forwards, or you can have them sitting on your lap in the same sort of position and rocking, holding on to them, rotating them, patting, rubbing, all sorts of different techniques for burping your baby. Not all breastfed babies require burping. Some don't take much air in, but some do and really benefit from being burped partway through a feed. If your baby is fussing at the beginning of a feed, it may be that the milk is flowing too fast for them to cope with. You have what's called a fast letdown reflex, when the milk is coming of its own accord and the baby isn't having to really work for it. And if that's the situation, you might find it helpful to just express a bit of milk off before the feed begins to slow down the letdown by the time that the baby comes on, and that way they might manage to cope with the flow of the milk a little bit easier. How do you know when your baby's had enough milk? Well, generally speaking, they come off by themselves, and when they do, they look completely drunk. It's a very lovely sign. Every baby takes different lengths of time to feed, and the time they've been on the breast doesn't tell you how much milk they've taken. So when they come off, there's a good chance they've had enough, but try burping them, and if they burp, then they may want to go back on and have a little bit more. It's always worth offering the other breast at the end of a feed, because some babies do want both breasts, others are only ever interested in one. Some may only want a little bit from the second breast, as it's almost like a drink for them to wash down the food at the end of the first side.